that is to try and support memory, because we call our dementia care units memory care. It's not really about memory care. So in order for us to become dementia aware and really focus on what's real, we have to understand what it is we're dealing with, and it's executive function loss. So before we launch into bathing, I want to talk about how emotionally charged bathing is, because all of our residents have basically PTSD about some bathing experience in the past. We all do. We all have some, maybe somebody walked in on us when we were bathing, or maybe when we were a little kid, we accidentally slipped in the bathtub and our head went under, or there's all these emotions that could be attached to bathing when we were a lot younger. How does an infant react to their first bath usually?
Crying.
Yeah, it's frightening to them because they're having to use their senses and learn. They're getting this information. How does the water feel on their skin? And there's this sense of maybe mommy's holding them, but there's this sense of unusual feeling in the water. And interestingly enough, infants, when they're first born, you know how they move really like this? It's because they were in water and now they're not. And so when they move, there's no resistance. So there's that trauma when they're born of not being in water, and then we put them back in water and their brain is trying to, all this sensory stuff, how does that feel? How does it sound? All of this stuff that they're having to learn, this information, and how it makes them feel. So we have that in the back of our brain. Now we're adults and we're losing executive function on how to process what's happening. So we're going to talk about all the different things that you can be feeling as an adult when you're taking a shower that can be negative, and why they resist our bathing and showering, and how we can join their feelings to learn how to better, because when we're doing a care approach, what's one of the most important things we have to do is join their feelings in the moment. They can only process in the moment, right? Everything else is confusing to them. It's not about
memory loss.
Memory loss, exactly. It's about the loss of ability to process, to think, to understand what information is actually coming at us, and how we can use that information, and how we can't use that information if we can't process it. So everything that we see, everything that we hear, every piece of information that comes to us, we have to be able to process it in order to use it, because it's all about how the information makes us feel. We can't learn anything unless emotions and feelings are attached, okay? The stronger the emotions, the better we learn, but the stronger the emotions are, the more difficult it makes us for us to process when we get loss of executive brain function. Because that's actually what's happening. We're losing executive brain function. So that's why it's so difficult for our family members to get a diagnosis of what's causing dementia symptoms, because the medical community looks for memory loss, because that's what they've been taught to look for. And so they ask questions about someone's memory loss instead of their loss of executive function. So the question that we need to be asking forefront as leadership and as care providers is asking the caregiver if their loved one has lost the ability to process habits, tasks, things that they could do in the past on autopilot, but now they can no longer do that. So can they balance a checkbook when they could balance a checkbook before this all happened to them, right? Could they plan a dinner party before, but now they can't because that executive function is lost? Not can they remember. That doesn't have anything to do with it, because they actually have memories from the past, right? And why are those memories from the past still in their brain? Why do they have the memories from their past? Because they stored them in their brain when their brain was still healthy. Now, because they have a cause of dementia symptoms, they can't store new information. There's no place to store it. So it looks like memory loss. It looks like they're not remembering something currently, but it's not that they're not remembering, it's that there is no place for them to store it in their brain. For example, what I use is if Bethany had loss of executive function because she had Alzheimer's or Parkinson's or one of these causes, if I asked her this question, how would she answer? Would you like chicken or fish? Which one would?
Fish.
Yes, because when I
That's
pull,
the wrong answer.
exactly. Even though she doesn't like fish, she would answer that way, because when I say chicken and pull it away, that information is gone because there was no place for her to store that in her diseased brain, basically. So she answers in the moment, fish, but what's going to happen when I come bring her fish back?
She'd be upset if she doesn't like it.
She's going to say, I didn't ask for that. Because even when she said fish, when I walk away, that information is gone because there's no place for her to store it. It's not that she's forgetting, it was never there. But if I talk to her about her past, she's going to be able to talk to me about that because she stored that information along with how that information made her feel, because they're stored together. She stored that information in her brain when it was still healthy and had a place to store it. Okay. In basic training as well, anosognosia. Who remembers what anosognosia is about?
Not realizing
That they have dementia symptoms, right? Because the part of their brain that would know that they're impaired is not working anymore. So they think, that's why we walk up to them and we say, which we shouldn't be doing, is asking the question. We don't ask questions, right? If we walk up and say, can I help you with a shower? What do they say?
No.
What else do they say?
I showered this morning.
I already did it. Yes, because their brain believes they're still accessing that normal brain function that they accessed before in the past. They really believe that they're taking care of themselves, right? So that's another resistance, because if we ask them, instead of doing a positive action and thinking for them, they'll resist us because they don't believe they need our help. So that's another big challenge we have, especially with baby, because that whole scenario is so frightening for them. Their brain, our primitive brain does three things. Our primitive brain accesses pleasure. Our primitive brain resists pain or discomfort, and our primitive brain rests. Does three things. And so when we ask that person a question and their executive function, and they're losing more and more, they're going to go to their basic primal brain and they're going to resist us because that has feelings of pain for them, okay? So they're always going to tell us no when we say, would you like me to help you with a shower? That's immediately going to bring up all of these different kinds of emotions that we have to join. So, we never ask them if they need help. How does that make them feel when we ask them if they need help?
Like their children.
Yes, and they immediately go to that place in their brain, I don't need help. Number one, we don't ask the question, what do? What do we do instead?
Come with me.
Come with me, yes. And we can talk about bathing, but I wouldn't use the word shower or a bath because those words are emotionally charged, like we're going to talk about. So come with me. What else could we say?
We're gonna wash up.
Let's get cleaned up. Or, I got some, your favorite shampoo, it smells so good. Or, how about your daughter's coming and she loves it when we do your hair. Anything, why? How's that making them feel?
Better.
Yeah, positive feelings, right? So positive action statement. Come with me. I love it when we do this together. So we want to join their feelings. We want to give them some reason, but we don't give them a lot of time to think. Why?
Because then they resist.
Exactly. So we jump in and we get it done. So no questions or options. We join their feelings. We use positive action statements. We always stay calm, confident, patient, and present in their moment. We don't talk about yesterday and we don't talk about tomorrow. We talk about how they're going to feel in the moment, okay? We realize and accept that you can't stop, fix, or change the symptoms, behaviors, or decline. And our goal is as often as possible to help them to feel loved, safe, secure, and valued. So this is our dementia-aware mantras, always. We always start with this, anything that we're doing. To understand why dementia residents may resist bathing, consider these factors. These are some of the feelings that might come up. Confusion, they may not recognize the bathing process or understand its purpose anymore. That may be completely foreign to them now. They probably are having difficulty with their sensories, like smell. So even if they smell bad, they may not even realize that they smell like urine or feces or any of that. So they're not going to understand that. So what's going to happen if we tell them that?
They're gonna get upset.
They're going to be upset because they're not going to believe you. They're not going to trust you. The most important thing is when we join their feelings, that's when they trust us, right? So there's a fear. Water can be intimidating, leading to anxiety about slipping or drowning. And we're going to talk a little bit today about how there is actually a dementia symptom where the ability to process temperature is gone. Every executive function that we learn can be lost throughout our lifetime if we get a cause of dementia symptoms, including the ability to understand the difference between hot and cold. We learn that, and you can lose that. I know that, I've heard it. I know that your residents sometimes are going, oh, the water's too hot, the water's too cold. And you're going, no, it's not. But it's not that the water's too hot or too cold. It's they no longer have the ability to understand temperature anymore because that's a learned brain function. And they can lose that, okay? And just their loss of balance and coordination. Getting in the shower is extremely fearful because, they're getting into this cave-like thing, and that's intimidating because they can no longer process the perimeter. They get tunnel vision, so it feels very enclosed. So it has to do with what they see, what they hear, how they touch. All of their sensory can be absolutely gone. So we're throwing them into something that they can't process anymore. Discomfort, sensitivity to temperature changes, and that the feel of water actually can become painful because their skin is thin. So that pressure can become quite painful. I've seen them, ow, 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 and it's really painful for them. And you're going, what is going on, right?
I had a lady scream like murder when I was giving her a shower.
Yes.
I was like, oh gosh.
And she's actually feeling that discomfort and pain because her brain can no longer process. We do not feel with our skin, we feel with our brain. Your brain has to process that in order for us to understand it, okay? Okay, loss of independence. They may feel a loss of control over their personal care routines. What do you do? Like this morning, I woke up and I'm washing my face and I'm putting on my makeup and I'm brushing my teeth. And I don't have to ask for help with that because it's automatic. I have that ability to process. This is what the toothbrush is for. This is, right? So they no longer have that. And that has to be really frightening, don't you think? If you're looking at a toothbrush and you don't know what to do with it. And then there's that whole routine disruption. So changes in their daily routine. Okay, so why don't dementia residents like to shower? So dementia resistant, okay, they're going to resist showers, there's discomfort. So how can we alleviate these concerns? How do we do that? That's what we're going to learn today. We have to join their feelings. First of all, we have to adapt the showering practices to accommodate physical limitations, past positive or negative experiences, and the feelings. It's all about how we make them feel, connected to the individual's loss of ability to process. That's what's essential, because we want to promote comfort, autonomy, and hygiene maintenance in someone who can't think or process any longer. So we have to think for them, right? Caregivers, we have to receive this dementia-aware training to understand this is very unique. This is nothing to do with our assisted living residents because they can think, right? So we have to be more proactive and thinking, and each individual is different. That what makes it hard. You know, if you all were my residents, you each would have a different kind of resistance to this. So we have to join where they are. How do we get past this resistance? Well, we have to learn to choose wisely. The best way to bathe, and there's absolutely no standard answer, is really getting to know, why can't I make it stop? Really getting to know your, how much, do you all remember the whole cheese theory that someone with a healthy brain has cheddar cheese, but somebody with dementia symptoms got a dirty rat in their cheese, like Alzheimer's or Parkinson's, and so now their cheese looks like Swiss cheese? They go to access cheese like they have all their life, which is basically their executive function, and now there's holes, but they don't realize there's holes, right? But everybody has different holes, and everybody has different cheese. So our job in dementia awareness is to support the cheese they have and fill in the holes for them, okay? So we have to encourage independence. So if whatever they can do, we want them to be able to do and really support that. And then we just are really careful about watching when they're challenged. And we don't ask questions. We don't say, what are you going to use to wash your face? And there's a washcloth and soap there. We don't ask that. We just get it ready for them. Here, wash your face. You know, that you do such a good job with that. And then we're prepared. You know, we have a big towel. It's really nice if we can have it warm, but if that's not possible, soap and shampoo, we get it all ready, and we make that comfortable by, and like I said, being aware of chilly surfaces and covering that with a towel. We mind the temperature. We make sure that your hot water heater is really to the bare standard, because they won't realize if it's too hot, because they no longer have that control of temperature. So we have to think for them. And always test the water with your hand, but they may not agree with you. But if you know it's safe, then you get it as warm as you can or as cool as you can and make it tolerable for them. But they may not be agreeing with you that they like the temperature. So you just have to know that you know they're safe, okay? And then afterwards, you might want to have them, you know, sit and do grooming in a like a spa-like way. So after they're clean, you don't rub their skin with a towel, you pat them dry. And you apply lotion and make that a big deal. Some lotion and powder in hard to reach areas like under any kind of folds. But make it like a spa treatment, that you're pampering them and that you love doing this with them. Okay, not for them. We're not really doing it for them, we're doing it with them so that they feel like a partner in their care. So it's crucial for we to understand underlying factors, especially when it comes to their feelings, and have strategies that will reduce this discomfort and fear. That's what the resistance is about. It's not about you personally, and it's not about them really being able to think this through. It's all about any behavior is underlying with emotions that are attached to these words, these events, these situations, and how charged the word shower is, right? So we need to have a thesaurus in our brain that has other words other than shower or bathing. And so what kinds of things have worked for you in the past? Instead, like you said, let's get cleaned up. What else could we use rather than showering or bathing? We really need to think about some things like that, right? We can be creative. You know, I had a family caregiver that I was working with, and her mom was living with her, and she also had small children. And it was during the summer, and she was telling me, you know, I can't get mom to bathe, and she's sweaty and dirty and stinky, and so the kids were playing in a little wading pool out back, and she said, come on, Mom, let's get in the wading pool with the kids. And she helped her in the wading pool, and they were sitting and splashing. And that became her bath over the summer because she couldn't get her in the bathtub. But then her clothes would be wet. She said, Mom, your clothes are all wet. Let's get you into some clean clothes. And she wouldn't change before that. But just the idea of showering was so frightening to her. You have to figure out something else. I've used this. I learned this quite a while ago when I was executive director, because we had some people that would not shower. I mean, they would not. And so we did the foot soak routine. Did I tell you about this during basic? Okay. So you're my resident. You're sitting in your room. This is so invasive. Come on, I'm going to help you with the shower, and I'm trying to take your clothes off. What are you going to do? You're going to resist me, right? But what if I come in and I'm, really positive? Oh, I want to pamper you. We're going to give you a good foot soak. And I've got this wonderful smelly, soapy water in a dishpan, right? Come with me. And so we go in your bathroom. You've got a little shower chair there. So I put that down and I take off your shoes. Oh, I love it when I can pamper you. Oh, and I give you a good foot soak, and I'm rubbing your feet, nice warm soapy water. And I'm talking about your grandkids. Your grandkids are so cute. Your granddaughter looks just like you. She's so beautiful. And then, here, let me rinse your feet. I've got this handheld shower. So I'm rinsing. Oh my gosh, I got your pants wet. Here, stand up. I've got some nice dry pants for you. And so here, hold this towel right here. And I take your wet pants off, because we take wet clothes off, right? And I've just got this, and I'm talking to you, and I said, oh my gosh, I'm so clumsy. I got you all wet. Here, while we're here, let's just get you sprayed off. Oh, your shirt's wet now too. Okay, I've got you all cleaned up. Oh, you smell so good. It's just so wonderful. Your granddaughter's coming to visit today, and I've got a nice warm towel to get you all dried off. Here's some clean clothes. Come on, let's go get ice cream. Boom, boom, boom. Right? I did not let you think, because the minute I would say, let's go take a shower, what are you going to do? You're going to start thinking. You're going to start feeling resistance. But there, we just had fun. We did a spa day. And, oh my goodness, I'm so clumsy. I got you all wet. What do we do with wet clothes? So we're proactively thinking for them, right? Okay. All right. We use visual cues. When your resident progresses through the stages of dementia, we show them. It's like show and tell. We don't just tell them. Why don't we just tell them? What are they hearing when we're just talking? What do they hear? Yeah. So we have to, you can even use pictures or show them. When I was executive director, we had some really, really difficult, challenging residents that did not like their showers. So I actually instructed the caregivers when it was their shower day to wear a swimsuit underneath their scrubs, because they were going to get in and get wet, because that was the only way we could do it, was just to get in and get wet. I had one resident, we had so much difficulty with her, but if we sang to her, because she would cry and scream, if we sang to her, raindrops keep falling on your head, she would laugh but we had to get in and let the rain hit us too, and talk about it and be with her in it. And then always consider a sponge bath. If you've got someone that's really resisting that shower, maybe showers are too much information for them. And sponge baths are what's gonna have to happen. And I like the big car sponges, the great big ones, and that you can get them real soapy. And then, give them 2 of them, and they're helping you with that, and make it into a game where they're actually helping you. Maybe they're getting you wet too, hitting you with the sponges. That's okay. You're going to just really jump into them. And then bath time is always an opportunity to look for any kind of skin problems that are going on. There might be irritation or bed sores or bruises, and that's the time to get that done. You're really in there with them, and you have the opportunity to check out their skin. They get really what a shower is to them is sensory overload. That's exactly what it is. There's the noise of running water, the sensation of the water pressure, the sensitivity to temperature, the fluctuations in temperature may trigger distress or anxiety. So feelings of discomfort and fear are the biggest challenges we have when it comes to showering. It often leads to this resistance that is unique to them. So someone might walk up to me, and I do not like to be cold. I am very, very sensitive to cold. So if you took me and I had dementia symptoms, this is what I'd want you to know. I want that bathroom to be nice and warm. I want my towels to be warm. I want that water to be warm, running warm already. I don't want that time frame where the water's going to be cold for a minute or 2. I don't want to touch the sink that's cold. I want that covered with a towel, because that personally is something that would really frighten me, because something cold is very unpleasant for me. I don't like to drink cold water. I don't, all of my sensory is very unique, and it might not be with everyone. Maybe someone else might not like to walk into a steamy, warm room. That might be make them feel very claustrophobic, okay?
That's my grandpa.
Exactly. Isn't this interesting how it's all about our brain? It doesn't really have anything to do with our body and our skin and what we think, because it has to start with us getting in their head and the feelings that this all has to do. You're not going to walk away ever. I don't care what's happening. You do not walk away from them when they're in the bathroom and there's any kind of water running. Play soothing music, sing with them, and remember their dignity and privacy. They may have some really background. I had a lady who had been brutally raped when she was younger. And she was a real challenge. So we would give her sponges because she would just be whacking us, and so we just let her do it because she was so frightened. And when we were undressing her, we gave her a big body pillow to hug, and she would bite it, and because she just couldn't stand that being undressed. And so she would hold that body pillow and bite it and squeeze it, and that helped her with that anxiety. So we have to find these specialized things, because always their feelings is what's driving this, right? We have to let them feel. Really do manageable planning. Really think proactively. So we want to have everything ready. We don't want breakable containers, of course. This is kind of just common sense, like glass containers for shampoo or anything like that. But we're going to stick to a schedule, because once you find that routine that works, you want to stick to it. And it might be different than another resident. Maybe they enjoy to shower every morning before work, or a warm bath after a long day. So you want to look for times and conditions that are tolerable for them, because they can't learn anything new. If they have those memories from the past that were put in their brain when their brain was still healthy, they're not going to learn something new because there's no place for that to happen. So we want to try and find out what, if we can, what kind of schedule they were on before, so that we can stick to that kind of schedule as much as possible. And this is really important because a lot of family members don't understand this. That's why helping family members to be dementia aware is so important. But we're going to consider frequency. How often does someone with dementia symptoms need to bathe? We used to think it would need to be every day because that's generally what we do, right? But, you know, adults, the generation that we're working with now, the older adults, they didn't shower every day when they were in their prime. My grandfather bathed once a week. That was kind of his thing. So it's how we feel about it. It doesn't necessarily mean how they're going to feel about it. As long as we are keeping their skin clean and there's no incontinence that's going to break down their skin, really, maybe once or twice a week is okay. And to help the family members understand this, because I know you've had family members who come to you and say, well, you need to bathe mom every day. Well, that's not necessarily true. And if it's really a hassle, it's too stressful for them. So a good sponge bath can be really all they need. It just, maybe a sponge bath twice a week or a sponge bath every day, but maybe just a shower twice a week is going to be okay, especially if they're so frightened of it. It's just not worth that challenge of how they feel. I like a shower chair that doesn't have, is like a commode chair. I mean, what a great idea. I had a caregiver who taught me this, the shower chair that's like a commode, because you can get under there and clean them up when they're sitting down. It's great. And it's less invasive. So that works really well when you've got someone who can't stand for a long time, or it's dangerous for them to stand, or they've got these feelings of embarrassment. You cover the shower chair with towels, but still have the opening so you can clean underneath there. It's really less invasive. Whenever you come into, and I don't call it memory care because it's not, anytime you come into their dementia care community, he would greet you. He'd always salute you because, he was in the Air Force and that meant a lot to him. And he loved to dance, and he was a flirt. All of the female residents there, they all loved him. And he would really have court like the king, and all of in the hen house, and all of the ladies sitting at the dining room table just flirted with him during meals. They would laugh and flirt and talk, and he would just hold court. But he was a good old boy, and when he needed to pee, he would pee anywhere. He'd stand up, he'd be at the dining room table, and he'd stand up and pee right there. He'd just unzip, pee, sit back down. And, the families, that's unsanitary. And we could not get him, because he was quick, we couldn't get him we tried to say, okay, it's about lunchtime, let's go to the bathroom. Well, the minute he heard lunchtime, what was he thinking?
Lunch.
Yeah, all my women, I get to flirt. Oh, no. And he'd go sit down. He would not, that feeling came up that that was fun. He enjoyed that. He wasn't going to go. And once he got that feeling, he was at that point, he didn't have a lot of time. Like when you're toddlers, before they learn potty training, they're playing in the sandbox, and if you say, do you need to go to the bathroom, by then it's too late, right? Well, he was at that point. So he'd just pee when he needed to pee, he'd pee right now. And so I was watching this, and we couldn't limit his water, or his hydration. We couldn't do that. And if we asked him if he needed to go, of course, that's never going to work. Or come with me, the minute he'd see that we were going to the bathroom, he was done with that. He didn't need your help. He took care of that whenever he needed to take care of it. There was no filter there anymore. So I'm really struggling with it, and I'm in his room. I'm looking at the pictures of him in his flight suit, that zips up. So I'm looking at him in his one-piece flight suit, you know, the one that zips all the way up here, and he's shaking hands with Ronald Reagan standing outside Air Force One, and I asked the caregivers, does he still have his flight suit? Because he was really still trim, and they said, yeah, it's hanging in his closet. He wears it sometimes. I said, oh, this is going to become his meal uniform because all the women are going to love it, right? So we made a big deal. Oh, you need to wear this because everybody, oh, you look so handsome. So we put him in that one piece, didn't have a fly, okay? And so he would be having his meal, doing his usual thing, but then he'd stand up and he'd start to mess around with it, and we knew we had time. Oh, we don't want to get your flight suit wet. Come on, let's go this way. And the minute you'd say that, he'd come with you, and you could help him go to the bathroom. So we just started to wear that. Not only that, what do Air Force pilots wear on a long flight where they can't use the bathroom? Depends. That was natural to him, and so that became part of his uniform, and we completely were not so challenged with this because what did we do? We talked to his feelings. That's all we had to do. Was he no longer had that control in his brain, but we could help him control that by thinking for him. So those kinds of positive actions that we can take to help them succeed in this whole loss of executive function.